Revolutionary talk for revolutionary times. Promoting peace, liberty, and prosperity around the clock. LibertyTalk.fm.
Welcome to Living the Solution with Dr. Elena George. Today I have one of my favorite people on, someone who I respect highly. We're living in interesting times, as I always say, and it's just come down that there's going to be a revisiting of the Affordable Care Act after the election. And these are very high stakes. And I've been speaking about it for many years about how the Affordable Care Act is literally doubled down on the worst aspects of our healthcare system, the most expensive, the least available, and basically people are being, I think, priced out. And the Affordable Care Act definitely needs to go. And I think we need to have the doctors and the patients run the show this time. And this is why I wanted to have Mr. Tony Dale come back on. He's the founder of Sedera. It's a medical cost-sharing organization who I now belong to, who has been on the forefront of doctor-patient relationship and the using the patient as a consumer. And as the patient goes, that's how the healthcare system goes. And I wanted Mr. Dale to come, or let's just say Dr. Dale, come back on and give us an update on what Sedera has been doing and just open more eyes, because I think people have been hunkered down under the COVID situation for so long that it's time for to peek your head up and figure out what you need to do going forward. So, Tony, thank you so much for joining me today. It's always a pleasure to speak with you.
Well, Elena, thank you so much. I really value the invitation. It's a pleasure and an honor to be here as part of your broadcast. And I look forward to exploring the Affordable Care Act and any of the other areas that you choose to bring up.
Well, I love that. Well, let's get started. I mean, you are a visionary. You're from a country that has socialized medicine, and I love your story because I think it speaks to a lot of us who unfortunately enter the healthcare system, but you're different because you questioned it. Most people just say, well, thank you, may I have another, and there's nothing I can do, but you didn't take that avenue, did you?
I did not. In fact, when I had my first sort of, rude introduction to the American medical system when I injured my knee, having immigrated over here about 9 years prior to that, but not being involved at that stage in clinical medicine. And so it was a rather unique sort of situation for me. And I remember asking the orthopedic surgeon, because I knew I was self-pay, what's this going to cost? And he said to me, I think it'll end up costing about $2,000. And that sounded very reasonable to me. But I didn't feel exactly the same way, even though I was thrilled with the way the surgery went when the bills began coming, because he had only been talking about his part of the bill. Whereas I'd been asking a question, a perfectly honest and innocent question from the patient. The fact that I was a doctor, maybe he assumed I understood the system, but I didn't. And actually, I had just under $15,000 in medical bills, which that was in 1996. So in today's terms, that's probably around $35,000 in bills for what might have been a half-hour procedure. And I was really shocked. And for me, that was the beginning of a journey of asking a lot of questions, as you put it.
And those questions were, well, let me ask a different way. Did you get pushback from the questions? Were they able to answer them? I mean, people are very intimidated by taking their power back and really stressing the system. Make sure you understand why you're paying something. Was it a negative, or what was the response? I'm curious.
Well, it's a great question. And I was really surprised by the answers. The first person I called was the orthopedic surgeon. And he said to me, well, Tony, what do you think would be fair? And I said, well, you told me it was going to be, $2,000, and I understood that you were only describing your own part of the bill, but maybe if we went 50-50, that would be fair. And he immediately said, well, that would be fine. And I thought to myself, well, that's strange. Maybe I should have asked for more off. And if I had known then what I know now, I certainly would have asked for more off. But I took that initial sort of minor victory, and I called the MRI and the labs, and I called the hospital even, and even the hospital basically said to me, well, what are you willing to pay? And I said, well, I'll pay 50%. And they said that would be fine. Well, of course it was fine. The hospital part of that bill was probably 80% of the overall cost just for having their operating facility available for that little bit of time. And, the consequence was that they were charging me these huge bills. If I'd asked for 80% off, I probably would have still overpaid in that particular case. So, it's hard to know what questions to ask until you begin to understand something about the system. And for me, these were very fumbling early attempts to say, well, this doesn't seem right. I know enough about the surgical care to know that I've not been treated appropriately here in a financial sense. They fulfilled the medical part of the Hippocratic Oath to first do me no harm. In fact, they'd done me a lot of good. But they hadn't really looked at that in any holistic sense because they were leaving me potentially with thousands of dollars of debt when I'd had no expectation of what that debt would be. And so they were leaving me like they leave about 65 to 75% of all the people who file bankruptcy in the United States on a personal basis have a major medical component, and most of those have insurance in place. And even with that in place, they find that the out-of-pocket cost is going to be crippling to them. So this is what I was beginning to explore.
Well, see, this is I think people don't understand. Is this inflation? I mean, we're going to take a break in a couple minutes. I just want to start the conversation. Is this inflation real? Who makes up these numbers? And why are they so outlandish when you know from a self-pay patient, and you and I both know the system now since we access it that way, that it could be 10, 15, 20 times more for the same procedure, same doctor, same equipment. How do they get away with that? And who makes up these numbers? Have you ever figured that out?
Well, Dr. George, I don't know who makes the numbers up, but I could tell you a couple of quick stories. Let me tell you just one, perhaps, before your first break. Early in my journey of having, started a company to try and help people deal with these medical bills that were proving to be, so, outlandish and unable to be handled, I had a patient that I was trying to help. He belonged to one of the Christian healthcare sharing ministries and was therefore sort of interested and concerned about what his bills would be. I had called him up and explained that I was going to negotiate the bills on his behalf and on behalf of the ministry that he was a part of. And he said something really interesting to me. He said, oh, well, Dr. Daly said, I'm actually in charge of setting the medical prices for this university. And he described a large, well-known university medical system. And he said, I can tell you that in terms of how we set the prices, we just routinely look at, we estimate the costs, and then we multiply it by 400%. And I said, what? And he said, yeah, he said, you go and negotiate with everything you've got, because whatever you can get it down to, it'll be much closer to fair than what we've set the prices at.
That's crazy. On that note, let's take our first break. You're living in the solution. Welcome back to Living in the Solution. We're speaking with Dr. Tony Dale, who's the founder of Sedera, and people need to go to sederahealth.com, or you can also access Sedera through my website, sedera.com/control your health. Now, before the break, you just gave an astonishing number, 400%. That's beyond gouging. And is it because the insurance companies have been that middleman, that go-between, that they somehow have blunted what the patient is really able to see? Is that how did it get started and how is it being maintained?
Well, Dr. George, that's a wonderful question, and I wish I could just point to one thing because absolutely there's price gouging throughout the system, but it isn't one thing. I don't think someone woke up one day and said, "Oh, I'll bet you if I charge twice as much, I could make so much more profit," and that was the end of the story. I think what happened is that the whole system has moved from a system of the doctor and the patient coming together for a mutual exchange of value. That's really what the doctor patient relationship is. The vast majority of physicians, yourself, myself included, we went into this as a calling with a real sense of what we could do to try and be a blessing to people. I'm a family doctor. My family, in terms of how I was brought up, my dad was a family doctor. I watched him. In terms of how he was brought up, his dad was a family doctor. He watched him. Some of my earliest memories are going out on nighttime house calls with my dad when I was just a kid and, seeing how the family so valued and appreciated him. And the exchange of value might have been money, or it might have been a chicken. And the truth is, he was equally happy either way, as was the patient, because the patients had enormous respect for him, and he had enormous respect for the patients. But whenever you begin inserting third party payers, that mutual respect, which is at the foundation of the doctor patient relationship, begins to get eroded. So, for myself as a physician in the UK, working as a family doctor, I didn't understand a lot of these economic things in those days, but I did understand that most of my patients had very little automatic respect for me in the way that I had seen, generally speaking, in the medical community. I was a commodity that could be had for free. At least it felt free to them. Of course, it's happening through everybody's taxes, but there was no exchange of value. But it wasn't just that a lot of the patients didn't necessarily have much respect for me. I began to see in my own attitude that because they were looking down on the high value I was trying to bring to them, that was engendering in me sort of a disdain, a sense of like, well, who does this person think they are that they can just abuse my time or whatever like this? And I noticed that this wasn't the patient's fault. What was happening to me that I was losing my respect for the patient. And so then when you begin to look at all the layers of this onion that are created as, the British National Health Service was created, or as we look at the sort of mishmash of what we have here in the United States, where the government effectively pays 50 cents on every dollar. If you look at every medical transaction across the United States, they handle Medicare for the elderly, they handle Medicaid for those who are on the low end of the economic spectrum. They, handle TRICARE or things like this for people within the veteran system. And so most people are in a context where either the government is paying for them or it's paid for through their employer. And so they don't know. Now, once you move into a position where the patient doesn't know, you're not far from a situation where the doctor doesn't know either. If I if I'd asked the orthopedic surgeon about the MRI he was arranging on my knee, would he have known to tell me, hey, if you go across the road, you can have that MRI done for $350? No, but instead I'm just writing you a little note. You can have it done right here in the hospital that I'm a part of, and it's only going to cost you $3,500, 10 times as much. Okay, now whether he actually knew that or ignorantly sent me on that pathway, okay, it's still wrong. If the blind lead the blind, Jesus said they're both going to fall into a ditch. And I think so much of what we see in the health system nowadays is the blind leading the blind. The doctors have become kind of willfully ignorant. The patients are kept obscure because all pricing in medical circles seems to be completely translucent and impossible to penetrate, except in the rare practice like your own, where people have open access to that information. So we're looking at many different factors that create the environment where this price gouging goes on.
I think you did an excellent job of explaining that. I would add, too, that it's this faceless entity, right? So it can be a blind will almost, and there's no accountability. Everybody gets to kick the ball down the road or pass the buck, whatever euphemism you want to use, but they don't have to stand in front of the patient and tell them, hey, this is how much it's going to cost. Do you want to do it? And if people had that, and that's in my practice every day, I'll tell people how much something is, give them the option, first explain why I think it needs to get done, tell them the price, and then they get to decide. And that gives patients so much more comfort. I find that they really appreciate being part of the decision-making process, not only medically, but also financially. And you also made another really interesting point. When your dad was taking care of the patients, when you were taking care of your patients, you had a relationship with them. Your job, and as the Hippocratic Oath, was never to gouge anybody. It's to make sure that you can take care of them and it's cost effective. It really is kind of written in to the Hippocratic Oath. These guys who enter in as a third party, their job is to make money. It's simply profit by any means necessary. That's what people don't understand. So when you see these commercials, it's so hypocritical. Cigna and the rest of these guys getting on TV telling you how much they love you as patients, that is totally not true. They love your premiums. They don't love paying out. I can tell you that personally. And they'll wait as long as they possibly can to string both the patient and the doctor along until one of us gets tired or both, and they pocket it. I just think this needs to be a level playing field. And I love the fact that Sedera exists because it empowers the doctor and the patient. That there is no middleman. We're sitting across from each other. You value my services, I value you as a patient, and it's done. And it's much more cost effective. Now, we're about fixing problems, both you and I. And I think that if we would just have Sedera and have self-pay patients run this show, I think it would stop if you stop feeding the beast, right? What do you think about that?
I completely agree with you that it's in our power to change this, and the power is really in the hands of the payer. And so, if you think back to some of the things I just said, 50% for, 50% of the country, that's going to be paid by the government. That's a more difficult problem to tackle. And, that probably is going to need political solutions if we ever find, a party in power who have the political will and I guess guts to actually do something about the way the government is being gouged and the way the government itself gouges, all of us in terms of how those taxes get paid. Mm-hmm. But if you look at the other 50%, okay, the vast majority of those are getting their healthcare provision either through their employer or perhaps they're a part of the gig economy. There are maybe 20 or so million people who are part of that nowadays who are literally making their own choices and buying, for themselves. Now, if we look at the person who's paying as a normal consumer and say in any other area, they're going to actively engage in these issues, then very quickly we could bring the issues under control. I mean, let me give you a couple of examples. I needed a kidney stone dealt with last year, a very unpleasant experience that I don't wish on any of your listeners. And I was well treated by the physicians who looked after me, except they paid no attention to the financial implications of what was going on, even though I explicitly said to all of them that I'm self-pay and that I will not sign any paperwork that says, the hospital where I'm having the stone removed can charge me whatever it wants. I mean, who would go into a car dealership and say, well, once we've agreed on a car, I'll take it home and you send me a bill for whatever you think you can get away with? I mean, we just couldn't do that. It'd be crazy. If you have
Exactly.
to spend $100,000 for your car in North Austin, but you could buy it for $25,000 in South Austin, I promise you the North Austin car dealership would be out of business within 6 weeks, let
Hmm.
alone 6 months. But in the hospital world, everybody obscures these things, and not just the hospital world, in many clinic situations and the like. These things are deliberately sort of obscured in such a way that people don't know where the real costs are happening. So to illustrate by what I just told you I've experienced, I had signed something when I went in that said I would happily pay the Medicare price since I'm of Medicare age. And that anything that wasn't going to be handled by Medicare for me, that I would happily pay the Medicare price. Okay, I literally signed that. Okay, and then the bills start coming, and I look at, just let me give you one example, a metabolic panel, which you and I know, that the Medicare price is around $10.50. Okay, they charged me $650 for it. That's 65 times what is the Medicare price. I mean, this is absurd.
Hmm.
It's beyond absurd. It's obscene. It's wrong. And we absolutely have to find ways to bring the people who are doing this. It's people, but most of them don't know they're doing it. It's the system, and we have to challenge the system. So in that particular case, I've been challenging the system. I've been refusing to pay, and I've been tracking all my correspondence and all of this because, to be honest, I kind of hope they do take me to court, because that would be fine. I'd like in court to bring someone like Dr. McCary from Johns Hopkins to perhaps to be an expert witness on this issue of how hospitals so gouge on the pricing, and they do it from a non-profit environment.
I know.
This is a religious institution that has non-profit status, and yet this is what they're doing to the community they live in. It's wrong, and we need to openly stand against things that are wrong.
Oh, I can't agree more. That whole nonprofit is a scam in itself. They don't pay taxes, but they're getting the services in the city. They cost everybody around them more money in taxes because they're not, pulling their fair share, and they're making a ton of profit. Those CEOs and the administrative fees, that whole infrastructure is ridiculous. I mean, there's I think it's a 16-to-1 in administrator to doctor ratio in an average hospital. Those guys don't do anything but push pencils around in paper and then tell us about MIPS, the meaningful use, and getting people in and out, and the nurse managers. It's a business to them. But to be able to really take care of your patient and be a physician, I've dealt with it peripherally, doing contract work, and I'm so happy that I get to come home to my own practice because I don't know how those guys do it every day, but I do see the morale isn't great, and it should be about patient care, and it's not. And I think that we have so much power, and I think it's already there. I don't think we need to wait. And let's explore that more when we come back for our second, take our second break. You're living in the solution. Welcome back to Living in Solution. We're speaking with Dr. Tony Dale. And I mean, it's just disheartening if you don't know anything of what we're talking about, and you just want to take care of your loved one, you just want to get better, and you're stuck in this sinkhole where you potentially will lose everything that you have in order to access it, in order to get healthy. And I don't think Medicare is any better. I do remember when my aunt passed away, my dad had to sell all of her property, to pay Medicare because she had too much money. I mean, you shouldn't have to lose your wealth just to get healthy. And that's just tragic. And I think that's within the government system, and I think that's within the commercial system. Maybe not as, it's not as injurious because the government owns you. They can just attach and take. Commercial insurance can't do that. But, in the big picture, you're paying more than you should. And you always have to ask the question, who stands to gain, don't you?
You really do, and there is so much that we can do if we'll just open our eyes and say, "I believe the system can be changed." Elena, that's
Yeah.
really what I did in the starting of Sedera, was said, we don't just say there's a problem, we say there's an answer.
I agree with that. And the first part of our show is an example of that. We're talking about 400%, 65% of the allowed amount if you stay in the system and don't question it. That by definition, you just described why it's important to take your power back and exit the system. And I think there's some sort of fear, and I think the average person is afraid that what if something major happens? Can I afford it? If I have to have surgery, if I have to be admitted to the ICU? But Dr. Dale and I are here to tell you that there is an option, and Sedera is that option. I mean, I guess most people say, well, how can you do that if everybody's paying in? I think for me, most people who are in it are healthy. So it's like you're putting money in for a future event, which may never happen. But at least when you do need it, it'll be there. Isn't that true?
Yes, well, let me try and describe it a little bit differently because
Okay.
when you're involved in a medical cost sharing community like Sedera, it's very important to understand this is not insurance. Okay, this is a completely different way of looking at things. So, in an insurance contract, which is a legally binding thing, you do put your money in before the event, hoping that the event won't happen. But if the event does happen, you've shifted the risk over to the insurance company, and the insurance company will then pay for it. And any money that they don't need to pay out, they're allowed to pocket. At least in simple terms. For those more knowledgeable, there are things like medical loss ratios where the government tries to control some of these areas, but the truth is they don't control it at all well. But insurance is a contract where we offload our risk to someone else. A medical cost sharing community like Sedera is actually completely different. It's much more like the sharing economy. Now, we're all familiar with things like Airbnb, where you could have someone come and use a spare room in your home over the weekend, and it's helpful for them. It's probably more friendly and perhaps more convenient than a hotel, and it's convenient for you because you're making a little money off that asset that you have, or maybe someone drives for Uber or Lyft, and so what they're doing is they're taking their car, which is an asset, and their time, which is another asset, and they're making it available to other people who are willing to pay for those assets. In a similar way, but if you flip that coin over of the sharing economy and you think about sharing liabilities. Okay, when you share a liability, which is what we do in the medical cost sharing environment, what we do is I'm voluntarily, willingly, not under some contract where I get in trouble if I haven't done it, but I voluntarily am saying I want to contribute to the medical needs that are occurring in this community. And what I'm trusting is that just like I'm contributing month after month, and thankfully have been really well. Now, maybe next month I actually get seriously ill, and other people in the community are still contributing. And so, what we do in Sedera is we allocate those funds that are freely, voluntarily contributed, and our work is to allocate them to any people within the community who have needs that fit within our guidelines that basically are anything unexpected that happens to you in a medical sense or even in an accident sense, that the community is there to work with you and to help you to see those bills paid. And in speaking for community and watching the millions and millions of dollars that are flowing because of what Sedera does, we've seen every medical need shared that has been presented to us according to the guidelines over the 6 years of our existence. And it's exciting to see what can be done in a voluntary environment without the need of all the middlemen telling us how it should be done.
Well, I want to make two comments on that. From a commercial insurance standpoint, if that is a contract that the patient is signing, they're absolutely getting ripped off. Because I can tell you personally, for many years, the bigger the ticket item, the less likely they're going to have it paid without some sort of secondary, third, tertiary. You have to fight for it. and they change the rules constantly. They don't follow their own rules. It's really annoying. And I think from the medical cost sharing side, personal responsibility becomes one of the most powerful tools. You don't enter into this lightly. You enter into this with the mindset of I'm here to work within a community to help other people, and I know they feel the same way about me. So if it is catastrophic and unknown and you need coverage, there isn't some person saying or a middleman saying, what can we do not to pay it? I think that mindset is completely reversed in the medical cost sharing community. And that makes a huge difference on the quality of the care and the mindset and peace of mind, frankly, for the members. And I wish that the opposite side would have empathy. I think that's the difference for me, Tony. It's the empathy. That's why I joined. I want to help somebody. I know if I need help, someone's going to help me. But we all have a personal responsibility. I'm not going to be smoking and drinking and doing silly things and then, oh, well, it's all covered. I'm going to get mine. That's not the mentality, is it?
No, what you're sharing is so important, Elena, because we view as foundational within a community like this that there's both personal responsibility, that I'm choosing to live healthy, and there's a community responsibility. I'm aware that other people are voluntarily sharing in all of my medical costs, and I'm voluntarily sharing in theirs. That means I'm going to use that, my access to the medical system wisely. I am going to ask whether I can get my MRI done on one side of the road rather than the other. I am going to question if it's appropriate to charge me $600 for one blood draw where they're going to do a few electronic tests running it through the machine. It might cost the lab $5. They might charge the doctor $10. So why did the hospital charge me $650? These are things that we need to be asking. And you put your finger on it when you said that typically the larger these bills get, the more difficult it is to persuade the insurance companies or the providers to pay for it. Whereas in a medical cost sharing community such as ours, we have no motivation to say that something won't be paid because we don't get to keep any of the money. All the money that is there for medical cost sharing, every penny of it goes to medical cost sharing. And if we ever found that we had too much money, we'd give it back to the people. And if we find that we have too little, which is also possible, although thank God we've never seen that happen yet, then we would ask everybody, in a given month, they might need to say, well, maybe we can only afford to take care of 90% of the bills this month. We'll try and make up the rest the following month if we can, but it's not a legal obligation. This is mature adults choosing to be involved in a system which is demonstrably saving people approximately 50% of their medical cost.
That's a huge thing. I mean, if you want to compare apples to apples, I have folks coming into my office with commercial insurance. They're paying a premium, thousands of dollars in some instances every month, but they're out of pocket. I've seen anything from $500 to $10,000 out of pocket. And what that means is they're paying the premium and they're responsible for up to $10,000, whatever their policy states, before the insurance plan kicks in the first dime. Why would you carry a plan like that? They're just making money on you. Or the people who go to the doctor maybe once a year for a regular checkup, and they're just paying this premium. It's just going into a black hole, and they're making out like bandits on the backs of people. I mean, I would love to see, I've written about this ages ago, but I would love to see if you didn't use your deductible. You paid into it, but you didn't reach it. It should roll over to the next year so you actually don't keep starting from zero. I mean, they can do little things to make it user friendly, but that's not their mentality. Their mentality is make our money no matter by any means necessary. And I understand that they make thousands of dollars per day based on how late they pay, right? So they're making, if they want to, you submit a bill, a claim, every day they pay late, they're making thousands of dollars per day that they paid late. So by the time they actually pay you, they've already made in their interest rates, what they would have paid the doctor. I mean, it's just outrageous. It's such it's not a level playing field by any stretch of the imagination. And we're going to take a break in a second, but I want to tee up another more specifics on how Sedera, in terms of cost for the member, differs from those premiums. They're not a premium, but I got to tell you, I'm paying a lot less for my office staff than I did under United or Cigna or whatever. I was just getting completely robbed, and every year it was going completely out, just off the charts with no sick people. And as a small business owner, I think that's a major thing, especially in the age of COVID, that people need to understand that you don't have to break the bank, but you can still take care of your employees, and it can be a family. And on that note, let's take our last break. You're living in the solution. Welcome back to Living in Solution. We're having, I think, a very important and enlightening conversation with Dr. Tony Dale of Sedera.com. And Tony, I gave my personal example of how cost effective this is. And people may think that, it's just going to be so expensive, and it's not. But I guess when you're not paying 400 times more than you should be, then you can keep the prices reasonable for the members.
Well, that's definitely the case. And I think there are a couple of things to say for people to perhaps understand who are listening to this. Under the Affordable Care Act, it's really become the norm here in the States for people to have a $5,000 deductible. The vast majority of people who are buying their plans on the exchange or, even through companies, whatever, the typical deductible now is around $5,000 for an individual, maybe $10,000 to $12,000 for the family. And the important thing to understand about this is that if you have a company with, let's say, 20 employees, 19 out of 20 are not going to have $5,000 in medical bills during any given year. So that means all 20 employees and, of course, their employer are paying, their part towards these sky-high premiums. But there's probably only one person in 20 who's going to receive benefit during that year from those high premium costs. And so you have a system that tragically leaves most people functionally uninsured. So what I mean by that is for any of the 19 out of 20 that we've described in this sort of example small business, if their kid, breaks his ankle playing soccer, or one of the family need some sort of admission, shall we say, for a gallbladder or whatever it might be. Okay, for the 19 out of 20, the smaller things, which typically is meant the things under the deductible, they have to pay it all themselves before the insurance company pays anything. So, the broken ankle or the emergency room visit or whatever it might be, you don't get help even though you've been paying all that premium. Okay, now the approach we have in Sedera is completely different. And it does typically represent in the 50% region of saving, whether it's individuals or whether it's groups coming to us through through businesses. And the reason we can keep it at about half the cost of what they would be paying in an insured environment is that we do have everybody understand that they are now personally responsible, that they're choosing to be a self-pay person. They're actively choosing to be a consumer in this system where we're going to hold their hand, help them understand how you be a consumer, answer their questions, help guide them where they can go, where they can get fair prices. We're going to negotiate things that happen in an emergency situation where perhaps they did not get a fair price. But into this context, when you become an engaged consumer, you can, by and large, have a huge impact on the price. Typically, just saying, I'm self-pay, when you go to the doctor or the urgent care or whatever, please can you give me whatever is the self-pay discount, will bring down your charges massively. When you then add to that the sophistication of the Sedera team in helping you and navigating you through the system, it makes an incredible difference.
I absolutely can speak to that. And as a surgeon, if I take a self-pay patient to our surgery center, which is not attached to a hospital, it's totally freestanding, they can get a 70% discount on the same surgical procedures that someone compared to someone using their insurance plan. So you're absolutely speaking the truth on that. And you just mentioned that Sedera walks you through, but isn't there also part of the Sedera process that they'll contact the surgery center or the hospital and work out or work on the bill on your behalf? So, if Sedera is paying, they want to make sure that you're going to get the best rate. It's in everybody's interest. And you have a whole team of people behind you fighting for that, don't you? You don't have to call up the person or the center yourself and do all this work.
No, we absolutely have a team of people who will do it. So we encourage everybody to reach out to us and to let us navigate them through. We're very happy to do that work for them, and because we know what a fair and appropriate price is to ask for. If
Mm-hmm.
you call up and say, someone is self-pay. And we want to make sure they're getting a fair price, and the surgery center or something offers us a 10% reduction. We know that's not a fair price. Okay. Now, of course, if they're publishing their prices, if we call your surgery center, if we call the Surgery Center of Oklahoma, or here in Austin, Texas, the Texas Free Market Surgery Center, they publish their prices. And so we know what the price is, and we know it's fair, and we're happy to pay the whole thing. In fact, we'll even pay for someone to come from, elsewhere in the country to come here and get it at a fair price, and we'll cover their costs and their hotel and everything, because it's still way cheaper than having them ripped off by their local hospital. So yes, we're there to help the person and to navigate on their behalf at whatever level they want. Now, if they carelessly or maybe inadvertently don't use any of that, and they rack up huge bills when we could have had a chance to help them save money, then we also have people who are skilled after the event to try and help clean up the mess. But it's a whole lot easier to do it beforehand than it is to do it afterwards.
I mean, educating consumers, healthcare consumers, is the way to go. And you also reward people for being savvy. People who have direct primary care as their baseline health delivery system, they actually get a reward from Sedera, don't they?
We do indeed, because we know that people who belong to a direct primary care practice or to a virtual primary care practice, who really have a solid medical home of a primary care physician who's looking after them, whose goal is their health rather than just trying to intervene when it's too late, in a sense, when they're already sick. So yes, those who are part of DPC practices, we actually allow them to contribute less every month than other people who are not a part of such a practice, because just by belonging to a good DPC practice, you're going to take care of approximately 70% of your medical costs overall. So you represent substantially less cost to the community, and so we happily will reduce your costs because of that.
Now, we talked a lot about the medical side, but there's some folks that have prescriptions and they have ongoing medical problems or pre-existing conditions. I mean, let's be honest, there's a whole group of people out there. And will Sedera be able to be a resource for any of those type of patients?
Absolutely. Now, it is really important to understand our guidelines. As a community, we're basically structured to work with people who found a way to choose to be healthy. But that doesn't mean that we don't care when someone has some sort of pre-existing condition. And I think there are a couple of things to understand here. First of all, both political parties in this country have made it very plain that whatever government, don't know what the right word is, whatever government framework there is for healthcare, that they're going to find a way to deal with all pre-existing. And that's important. A wealthy society like America should be finding a way to take care of pre-existing things. And there are all sorts of things like state risk pools and other mechanisms that are very effective and were working before the Affordable Care Act even came in. But we also welcome people. We do warn them that the first year that they're one of our members, if something is pre-existing, then that's not going to be shareable in the first year. But by the second year, we'll take care of $25,000 towards that cost, which for the vast majority of situations, especially negotiated the way we handle them, will take care of all of the cost for most people. But are there some things that will be more expensive than that? Yeah, they are. And so if people come to us with some serious and highly expensive pre-existing condition, we're going to tell them we're probably not the best solution for them. Okay, similarly with drugs, there are all sorts of ways that drug costs can be brought down. I mean, that I'm sure you've done whole shows on the drug issues.
Mm-hmm.
But drugs have their own litany of problems that match everything else that we've already talked about in the provider system for the rest of the healthcare world. And so there are lots of good programs to help people get fair pricing towards their drugs. And in fact, their drugs in an acute situation, someone who comes to us and, they've been discovered to have a malignancy or something like that while they're with us. And the drugs are a part of the treatment. And when treatment is leading to a cure, then we handle all of that within the need. But if a person is on sort of long-term forever maintenance medication, then first of all, we're going to help them through the various drug programs, find ways to get that at a fair price. And typically we can save them enough money that they're perfectly happy to pay that out of pocket because they're saving so much on their monthly premium costs that they previously had with an insurance company. But if they were in that rare situation where their drugs really are so expensive that that's a problem, again, we're going to work with them as to how that is resolved in the long run, because our program is not designed for long-term, meaning forever, treatment of things like hypertension or diabetes. Those type of ongoing conditions, after 120 days of treatment, we then work with the patient for how that can be handled effectively on an out-of-pocket basis.
I think that Sedera describes what I always talk about. It should be freedom of choice. Not everything works for everybody, but it's such an awesome resource for people who have the mindset and who fit the criteria. And I know it's always too short, our show, and we're always coming to the end too soon. But I wanted to thank you so much for coming on, because I think you gave a really great synopsis. And I think people need to know they have choice. You cannot make a conscious decision unless you know all of your options. And I personally and my office staff, I think this is an awesome choice for us. And I think small businesses specifically need to take a look at this, because it's one way to treat your employees, to keep them healthy and happy, keep your bottom line and not be gouged by the system. And I would also say it's really, again, all about personal choice and taking personal responsibility. And it doesn't have to break the bank, honestly. People need to go to sedera.com/control your health, or they should call 855-998-8075 to get more information. I think you'll be happy if you do. Tony, thank you so much for coming on today. It's always a pleasure. I really count you as a very special friend.
Dr. George, I so appreciate your kind remarks, and it's just been a delight to be here with you today. Thank you.
Oh, it's my pleasure. And thank you, everybody, for living in the solution.
Revolutionary talk for revolutionary times. Liberty Talk FM.